Hi everybody, and welcome to the Golf Zone Ledbetter Virtual Summit 2020. Can you believe it? We're in week 2 already, and we have an absolutely amazing session for you today, this evening where I am, and this afternoon where we have the guys from the Gray Institute, Dr. David Tiberio and Jonathan Moore. Hey guys, great to have you with us.
Stuart, thank you. It's a pleasure to be here with you.
Great to be here. Really honored to be part of the virtual summit.
No, fantastic. So before we introduce both of you as you deserve to be introduced, we'll just run through a little bit of today's session and how you, all of the viewers, can get the best out of this session. So the title of today's webinar is Functional Golf Training. And I know that David and Jonathan have got an amazing session lined up, some key topics to help you, the golfer, and if you're a coach or an instructor, to really understand the body and its blend with the golf swing a bit more. So when you look at the screen, you'll see a menu bar. Within the menu bar, there'll be a handout there. There'll also be a notification pops up at some point that will inform you of how to access some of the Gray Institute's content that they've developed for the Golf Zone Ledbetter University, and we're proud and delighted to be associated with them and have their functional golf training system specifically written for the Golf Zone Ledbetter University, and with a twist of the golf side of it and the golf instruction with it. And we've got some special discounts on those courses at the moment, so 20% off. And also in the handout, there's the schedule for the rest of the week and more information about our certification programs. I'm going to disappear and leave it to the guys in just a second. But what we want you to do is to be really interactive with this. Post some questions along the way. So while the guys are presenting, feel free to use the question option in the menu bar, ask some questions, and we'll get to those at the end. So it's only fitting that I introduce you both as you should be. You guys are well renowned in the world of golf for various reasons, working with top players, collegiate players, the work that you've done in the world of functional movement and physical. So Dr. David Tiberio is the Dean of the Gift Mentorship Program at the Gray Institute. His professional education in physical therapy is complemented by an MS in education and a PhD in sports biomechanics. David taught physical therapy and conducted research at the University of Connecticut, where he is a Professor Emeritus. In 2007, the American Physical Therapy Association honored him with the Kendall Award for outstanding and enduring contributions to the practice of physical therapy. David, we've got a little bit of an association together. We've worked, and I've had the pleasure of you speaking for us a few times. It's an absolute delight and honor to have you speak with us today, and I'm sure the viewers are going to have a great experience with you and Jonathan. Now, Jonathan's a former NCAA champion, Walker Cup champion, and professional golfer. His highest world ranking as a professional was 212. Jonathan's devoted himself to the game for over 25 years, and in recent years that devotion's led to an understanding at the highest level with the body and swing connection. Jonathan has the rare combination of playing at high level with a great understanding of the functional biomechanics as it pertains to the golf swing. He studied under Dr. Gary Gray and Dr. David Tiberio of the Gray Institute, and as the Director of Golf for the Gray Institute, helped in the design of the functional golf system. Currently, Jonathan is the strength and conditioning coach at Oklahoma State University for the men's and women's golf programs, where he trained current rising stars and well-known golfers such as Matt Wolff and Viktor Hovland. Guys, you have some amazing sections to talk about today. I'm excited to sit back and listen. I'm going to hand things over to you and let you get started with the session. So everybody enjoy, make some notes along the way, and don't forget to ask some questions.
Thank you, Stuart. Thanks for those great introductions. Jonathan, why don't you give us a quick overview of where we're going to go today?
Very good. Yeah, I'll just quickly first say one more thank you. Just it is a privilege and honor to be here. Some of you might know this, some of you might not, but I was a junior at the David Ledbetter Junior Academy, starting at the age of 15, and had the privilege of working with several Ledbetter instructors and David himself for probably about 10 years. So this is just fun for me to get to be here as a part of the Ledbetter Virtual Summit. So today we're talking about difficulties with shallowing the club. I think that's something that can be a struggle for the majority of golfers. You see that over the top move with the hand path or a very steep shaft angle coming down, where that club is very straight up and down as they transition. But also it can be something that even elite players struggle with. Difference is an elite player has the ability to make the compensation to match up with that. And so they do a good job of taking that steep shaft and doing something usually kind of last minute with their body and what they do to all of a sudden get the club on the ball the right way. Maybe it requires a little bit more timing to do that. There's definitely some players out there that still hit it very well, even though they require that timing. But I just think it'll be fun, Dave, to talk to this audience about that. Golf coaches, golfers, because I think it's a pretty hot topic right now. I think if you turn on the television and are watching, especially the PGA Tour coverage, you're seeing, a lot of comments being made right now about these players who, get that center of mass, that club to shallow as early as possible in the transition, and how that then promotes this rotational freedom of the body throughout the rest of the swing. And so I just think it's going to be something that, as we dive into from a biomechanics standpoint, an assessment standpoint, and then a training standpoint, that will hopefully just shed light on what this is and what's required from the body to make it happen.
Yeah, I think, Jonathan, people watching this can really sense your enthusiasm for understanding the swing at a deeper and deeper level. I think there are some biomechanical requirements that we may not initially understand when we think about what's in the golf swing. And Jonathan, your point about the fact that even the elite golfer can have this problem, but they have the ability to be able to make corrections last minute, real time, while they're making the swing in order to compensate for that. So from a biomechanics standpoint, we think, well, what are the body resources required in order to be able to not only get the club in a good position, but then from there at the top of the backswing to actually create this body movement that allows the club to shallow itself and come in through impact. And if we have to consciously think about the club, whether you're a golfer or a golf professional teaching someone, if you have to consciously think about what we're doing with the club, that might indicate that the body resources aren't there in order to allow that to happen. But we'll see later on in this, when we get to the assessment, how we can determine if that's an issue. Now, everybody knows that we need to have external rotation of our shoulder in order to be able to position that club and drop the elbow in and be able to shallow that club. And there are a number of people who test that, either standing up and checking the external rotation, or even better in a golf posture and checking that external rotation. And that will give us some important information, because we know we need to have that motion. But you might use the term that's necessary but not sufficient as a body resource to be able to shallow the club. You might find that someone has limited external rotation with that test, and they have a problem. But that test is so isolated and so different from the actual golf swing. There are really two places where that we might say at the Gray Institute it's not functional. And one of those is that in this position, when you externally rotate, you need your shoulder blade or your scapula to posteriorly rotate. And for that to happen, you need to actually have your thoracic spine to extend, but not extend at the hips and lose your spine angle. It needs the ability to go through extension within the thoracic spine. And so we have to have an ability to assess that. And then if it's missing, we have to be able to train that. So that gets us into that position. But the other thing that makes it a little too isolated and not integrated enough, as you know, Jonathan, is that that's checking one plane in isolation. But the golf swing, I have to have that motion when I'm maximally rotated with my shoulders to the right in a right-handed golfer, and I've laterally flexed a little bit towards the target. So the classic swing would be a combination of big rotation, little lateral flexion, but we have to have that extension within the spine in order to do that. So if you're not assessing and training in that position with that combination of motion in the thoracic spine, then we don't really know whether our golfer or the golfer that's going to the teaching professional, we don't know whether they have the physical resources to do that. And the problem is, if they don't have the physical resources, it's going to create some swing faults that you see commonly in golfers.
It's great, Dave. Yeah, I mean, it's been talked about, right? It's kind of that magic move to be able to get the club just kind of right in the slot, and it's almost that magic of the right arm. And it's even, oftentimes, you see it as like a sidearm pitch type action. And I think just the point that you made, though, is so important for our audience, is that, if we're not getting the help from the thoracic spine, and your golfer's looking a lot like this, it's going to be very hard for them to get that right shoulder to externally rotate, to get that right elbow to kind of be, coming up underneath. It almost gets underneath that left arm, where oftentimes, you see the player up this way, the right shoulder stays high for a very long time. It's all connected right there. And, oftentimes we make the mistake of focusing just kind of on the one area. And if we were to go a little bit further into the body, we might find some friends that could actually help out that shoulder. And that's true in a lot of things.
Right. And as you were demonstrating that, it reminded me that I didn't emphasize enough that once we're in this position, we're going to talk about the fact that the one thing that allows that initial dropping in or shallowing is probably the frontal plane motion of the thoracic spine. That when we start to move our pelvis towards the target, our trunk comes away from the target, which really is going to facilitate what the scapula needs to do, and then allowing that humerus in the arm and really even the club to drop down.
It's really it's a sequencing thing. You get up to the top of your swing and you've established some, tilting of your pelvis this way. The right side is raised, the left side is lowered a little bit. You have that frontal plane now, that side bend up above. And as you begin to shift, you don't right away go this way. Your hips still stay kind of on that inclination down for a while. So you really got to have the ability to get that thoracic spine. This is moving, it's changing. It's going from being very elevated to a little less elevated, but it doesn't just happen right away. So you got to really have some resources in your thoracic spine. Even though this is starting to free it up a little bit, I mean, wow, what happens up above here is amazing, because it's going from this rotated right, laterally flexed left position to, as those hips start to move and go that other way, there's a moment where relative down here, up here now, you're rotated right and you're starting to laterally flex right to get it going that way. We call that a type 2 motion, and it's an amazing motion that you need in your T-spine in order to unlock, like you said, that shoulder and that humerus, and get that elbow and right arm to work the way you'd like. So, Dave, if you don't mind, I'm gonna bring a friend up to kind of talk a little bit more about that, because it's actually something he's working on, and make a quick introduction and show him kind of how we might assess that. And I think it'll be fun for our audience to get that interaction.
That'll be awesome.
All right, so Zach Boshu, how about you come up here and join me for a second? Everyone, this is a good friend of mine, Zach Boshu. Dave's waving at him. Dave's known Zach now for a few years. Zach, I had the privilege of training as well while he was here at Oklahoma State. He was on that national championship team where Viktor and Matt were on that team as well. Zach is a 2-time Canadian amateur champion, national champion. He's already won professional events since he's recently turned pro. I know he can't wait for the Q school to come back around, right? So you can, have a chance to get back out there, Korn Ferry Tour, the PGA Tour. But has played in a couple PGA Tour events, showing he's got all that he needs. But I just wanted to bring Zach up because Zach's actually been on this journey now of working on shallowing the club. He for about a year has been working with Joseph Mayo, and I think you'd say you guys have seen some really good results, right?
Yeah, I started off being a little steep in transition. It's kind we've kind of been working through different ideas, essentially how to get me to lay the club down on the way down.
On the way down. It's perfect. And a little bit of Zach's history is, you know, a lot of people were really into this, you know, kind of lead arm depth people are talking about now, you know, getting those hands to get kind of behind you to allow the club to be able to, the hands to work out, which would then help to shallow the club. Well, that doesn't really fit Zach's pattern. Zach plays with some higher hands, similar to like a Justin Thomas or Dustin Johnson. I mean, Jack Nicklaus. There's been plenty of people that play with high hands, but then still do a nice job of shallowing that club. And so, you know, Zach, you're kind of getting tired of trying to get the lead arm depth. But here recently, they've really been kind of having some success. And you were talking to me a little bit about kind of that right shoulder and the hip. Explain that a little bit, what you guys have been doing.
So for me, I just kind of noticed, like, when I got like deep on the way back, I noticed my like right shoulder wanted to go like internal, and I'd kind of go like this and end up standing the club more up as I went, you know, essentially flatter. So I kind of figured that if I could go a little higher up, then this club would be able to kind of drop down with my hands and try to get this shoulder to kind of work external while the shaft is shallow. I would say my pattern looks a lot better doing that, rather than
definitely
trying to get super around me and then just go like that.
Go that way.
Yeah, so I would say that.
It's 100% looking better. And I mean, I think he had the privilege of having a sports biomechanist kind of take a look at some of his 3D and take a look at some of his swing, and really kind of notice that it just seemed like his right shoulder stayed quite high as he transitioned down. And so there was this real feeling you were talking about of almost getting like your right shoulder to go into your right hip.
Yeah. So Joe kind of, when we were hitting balls and we were working on this to try to get me to move this way, he just put his right hand on my rib cage here, and he said, "Okay, first move down, just feel like you're squeezing that rib cage as hard as you can and bending right early." Because I had a lot of right bends kind of at impact, and after impact, I just didn't quite have it early enough in my swing so I could shallow the club down early.
Perfect. So,
Jonathan, one of the things happening there, Jonathan, that I see is that great coach telling him what he needs to do. The issue is whether he has the physical resources to do that. And if not, can we give it to him so he doesn't have to think so much consciously of it and do it so many times to make it happen? But it's amazing that such an elite player, and I won't embarrass him, but you know, he can shoot under 30 on holes anytime. But we have the same problem sometimes with high handicap golfers. So before we get into looking at Zach, is it the same problem or a different problem if I'm a golfer watching this webinar and I'm saying, I do that, but you know, I'm not going to shoot under par? Is it a different problem or the same problem?
Yeah, I think it's the same. I think it's then how you know, skilled you are. Oftentimes you realize what you need to do, what needs to happen at impact. And so, you know, I'll just finish on what Zach said a little bit before I go into that novice golfer. You know, he said once he'd get down into the golf ball, he had a lot of side bend, and through the ball, he had tremendous side bend, almost, you know, I mean, too much, you know, putting pressure on his back. Well, that he didn't get any of it to happen early. It would stay too high, got the hands working out, shaft quite steep. So then his compensation was to start really dumping down and really laterally flexing, getting the hands real high and just staying laterally flexed through the shot. And so for him, trying to get it to happen earlier is going to free him up to actually rotate more level. So his compensation was, I'm going to start kind of stalling my rotation, laterally flex a ton, raise the handle really high, a lot of toe misses, and just kind of not as solid of a strike as he'd like. But yet still, exactly. I mean, we're talking an elite level, a guy who's, you know, winning professional tournaments, winning elite amateur events, so still figures out how to get it done. Oftentimes it's the same issue coming down for the not as good golfer. I would say the early dominoes and the backswing though might contribute more than to this pattern than sometimes the elite golfer. You know, the elite golfer oftentimes has a really good awareness of where their hand path is and their club plane is going back. and it might be more of a body issue that's causing kind of some of this right arm to work down this way, where oftentimes the novice golfer, they start doing some things that in the backswing that start creating that end over the top move. I'd say the body resource is still not there, but it might be some of those early dominoes that are causing it. And so usually what you guys are giving lessons on the lesson tee, see it all the time. As they get that steep shaft and as they get those hands over, well, oftentimes what happens is they don't make the great compensation and athletic move that Zach did to still get the club on the ball well. They end up continuing to swing around, lose all their shaft angle too early, chicken wing the left arm, kind of swipe across it, and you get those poles and the big slices, and there's not really compressing the golf ball, because if the club gets shallowed down, you can hold on to more angle because you're coming from more of a shallow position. Where if you're really steep this way, if you're really steep and hold on to angle, well, you kind of miss the golf ball. So you got to start casting that club and left arm breaking down, and you see, I think, a lot more of that with the novice golfer.
Great, that's great. Now, obviously, when you're working with a golfer yourself or looking at video of your own swing, you're looking for certain things. So in the functional golf system, we want to watch the golfer swing. So what are things you're looking for there? Is it just the overall picture, or are there any specifics that you're going to try to dig into?
Great question. So yeah, you got to watch someone swing a golf club first before you just start assessing them, I believe. I think it's you're just not going to get the full picture of what they do, because really the most functional thing you can do is make a golf swing if you're trying to assess for golf. So that's where the assessment needs to begin. So you're paying attention when you're talking about shallowing the club. A lot of it is this right arm structure right here. Now, obviously, the further that right arm were to maybe get tucked behind the person, so where that shoulder blade, scapula really retracts and those hands get behind them and there's not much width out in front of them, you're kind of paying attention to that. That could really make it difficult to get that shallowing of the club. And you're kind of paying attention to that right arm structure as far as where that elbow is pointing. Obviously, the further out that elbow gets, the more of a move it has to make to get back down in front and to shallow the club. Now, for some people, though, it's in a sense, it's not that that's okay to go from being out here to coming in, because that is going to promote shallowing the club. The problem is when it starts at an angle, and then as the person transitions down, it gets more internally rotated. That stands that club up and gets it steep. So you're really looking at what's the structure of their arm at the top of the swing, and then where do the hands move, and where does the right arm go in relation to where it is there. And if that elbow starts to work back away from and kind of increase the spread in the arms versus, in a sense, that spread closing a little bit as they get those hands kind of right on down where that left arm's parallel to the ground in transition, that's kind of what I'm looking for, because I'm really not, how does the person handle, you might have a very unorthodox looking backswing, but boy, all of a sudden, once you get to that next position right there in the swing, I mean, Jim Furyk come to mind, Matthew Wolff comes to mind. People, they have some very unusual backswing, but all of a sudden, once they get about right there, it looks as conventional and as good as anyone out there. So I really think you got to pay attention to how it changed, how the person handles what they're doing.
Yeah, and the point you're making is you could look at it and say that's not ideal, but we're not sure whether the person's stuck there or that's just the way they swing. But as part of our assessment, and I think you're going to take Zach through it, we have something called the position-specific motion buffers. We're going to focus on the backswing, and we're going to see how we look at it integrated, and then we're going to see how you can go plane by plane to isolate it. So why don't you take Zach through that right now, if you don't mind?
Very good. So Zach, you kind of just step right on in here where that's kind of a down the line view. First thing I would have you do is just go ahead and take your club up to the top of the backswing. Very good. Okay, come on back down. Good. Take it on up there again. Very good. And so, you're just kind of appreciating right now what that right arm position looks like, okay? So now come on back down again. Now this time when you go up there, get up to the top, and then I'd just like to see if you can take it further. So go ahead, and kind of the first thing we ask them to do is, can you go further? So kind of almost like pump it in and out a little bit, kind of, can you go further? So almost from like here to here. There you go. A little further, a little further. And now you're just, again, you're kind of paying attention to me, I'm paying attention to where's all the motion coming from. Is it one segment of the body? Now I know we're looking, the right shoulder is a segment of the body. So I'm focusing on, well, you know, is this changing a lot? And in his case, it's not really changing a lot. He's kind of maintaining that. It's not like all of a sudden he's spreading his arms a lot more to get the club further back. But I'm also paying attention to, you know, are his feet, are his knees, are his hips, is his trunk, you know, up above his thoracic spine? Is it all contributing to that rotation? Or is there one segment he's getting it from and not another? Obviously, you're going to get more from up here, your thoracic spine, but all of it we'd like to see kind of contributing a little bit. So that's kind of the first thing. Now what you got to do is for the motion buffer is you get your hands on them and kind of get a chance to really sense and feel. So I'm going to now get my hands on them in a way that I'm going to get to sense and feel his thoracic spine, kind of how well it extends, how well it laterally flexes, how much more it rotates. And I'm also going to kind of get a chance to get my hand on that right arm and see kind of what kind of pressure that right arm is giving me. And if that's any indication that he's at an end range. So that's kind of why we call it a buffer, because if he's at end range at the top of his swing, it's going to be less likely that he's then going to be able to all of a sudden go from where he's at and create external rotation. If he's already maxed out at external rotation at the top of his swing and there's no buffer, well, then you're not going to really see probably what you're looking for in the transition. So, and obviously for Zach, you know, it's something he's been working on. And so we're trying to kind of get a chance to understand if there is something possibly that's going on there. So I'm going to sneak around over here now. Zach, go ahead and go to the top of your backswing and just kind of stop there. Good. Now go ahead and kind of just pump it like you're going further a little bit. Good. And I'm going to kind of just get my hands on the club and I'm going to kind of guide him in extension a little bit. And so I got my hand kind of right on his back, kind of right on the upper part of his back. And I'm kind of feeling how well that T-spine was extending as I'm taking him back. He did a great job. Now I'm going to have him go back. And as he takes it back, I'm going to kind of laterally flex him a little bit. So I'm going to kind of get a chance to, as he's getting a little bit more rotation, kind of get a chance to see, is he at in range there or has he got a little bit more? Okay, very good. All right, now we're going to go ahead and go back one more time. And then I'm going to go ahead and see, just have him rotate a little more. Just kind of see that rotation. See that rotation, okay? In my mind, neither one of those was he at end range, okay? I'm going to have him go through it one more time, and I'm just going to change my hand position here. So go ahead and take it back there. Good. Now, as you go through that extension, I'm going to just kind of get a chance to kind of feel where that arm is working on me a little bit there, okay? He's giving me a little bit in his T-spine. Maybe I'd like to see a little bit more, and that would be, I think, a helpful thing for him. That's probably of all the motions. Let's go back to that lateral flexion and check that one more time. Very good. So kind of give me that a little bit more as you're going further. Good. Good.
Hey, Jonathan, one thing, I want you to throw in another one for him because of what you said earlier in explaining it. It's that transition from lateral flexion towards the target, then away from the target, that kind of facilitates that shallowing, but it's done in this extremely top of the backswing position. So let's see, not only can he go to left lateral flexion, but see from way back there how he does going right lateral flexion.
Perfect. All right. So he's going to get up there. We're going to kind of give him a little bit of left lateral first, a little bit of lateral first. Good. Okay. Now let's go ahead and give it that from that position. Let's give it a little bit of that right lateral. Good. Okay. Good. Trying to get that to change, trying to get that shoulder to drop down. You know, essentially he's getting better at it as he's doing it. You're seeing his body kind of start to warm up a little bit more as he's doing each little pump there. When he first went to go do it, you know, for me, which is what's great about it, is you're getting a chance to get right up next to it and feel it. The right arm was working really hard, but you didn't really see much change going on in his back. If I'm having the view right here, it just was staying pretty static, and he was trying to get it all with that right arm. As I was able to get my hands on him and cue him, it was all of a sudden the shoulders started working, and it kind of started to get that rib cage like he was talking about, which, you know, again, as golf coaches, you're so good at that. And he's talking about his Joseph Mayo, who helped him. You know, he put his hand on his rib cage there, you know, gave him that feeling, just something to, you know, that sensation there of, oh, okay, that's where I need to get this motion coming from, which was really brilliant because he understood the rib cage, that is the thoracic spine, which really unlocked that for him.
Yeah, you could even see it, Jonathan, that when he started to try to go in the opposite direction, he got mostly transverse plane in his trunk till you facilitated that, which brings up a couple points. And one is, we've always said golf teaching professionals are doing that because they're great at seeing motion and observing it and seeing what's going on. And if you're a golfer who wants to get this fixed, you know, you can try some of the training movements we're going to do in a second, but if you're having trouble with that and it doesn't seem to be working, then it's time to go see a teaching professional. Find yourself a great golf coach, they'll help you, and they'll facilitate that improvement a whole lot faster.
Yeah, I agree. Zach, do you have anything to add there? I mean, I really appreciate you being on.
When you're having me get into right earlier, because in my swing, you know, I just get into it too late, so it's kind of good to like, you know, just get to the top, just kind of feel myself right side.
Jonathan, we just couldn't hear Zach on that one, Jonathan. So could you repeat? He wasn't close enough to hear the mic.
Okay. Yeah. Okay. Yeah. You know, Zach was just talking about. He said he just really appreciated. He really appreciated the sense that he got from, you know, when I had my hands there, that he gets that right side bend late in his swing. And like you noticed, Dave, it was transverse mostly at the beginning. He was just rotating. And when I kind of started to cue him and get my hands underneath there and help it kind of guide it a little bit, he said he could really feel it. Oh, that's it. It needs to happen right away. It needs to happen early, which I think is right now where he's just kind of, it happens so fast. That transition happens so quick. And so where we believe, you know, if someone gets in the gym and adds some of these training movements, you know, you're just getting that body ready. You're starting to tell that nervous system, you know, and priming everything to do it, because that transition happens so fast that I think if you can add some training to it ahead of time, you're going to be off to the races a lot faster.
Great. Zach, thanks for being there. Really made a big difference. It made it easy for people to see, and it made it real practical. Thanks again. Keep playing great.
All right, guys. So that was awesome. That was really, I think, a treat for us to get to have Zach. Yeah, you'd just a great player, really humble guy, good friend, and I enjoy getting to play with him and train alongside him still. So a lot of good stuff. Dave, let's jump into some training. What do you say?
I'm ready to go. We got to just make it practical based on what we've told them and what they've seen so far.
Very good. So, you know, that's what we want. We want this to be a real takeaway for you. Hopefully you're starting to understand this body swing connection, external rotation of the shoulder, the friends of the body, the thoracic spine and the scapula and everything, and how that contributes to it. And so we're going to take you through a little bit of a movement series. The movement series is first going to be without any kind of tool or load. It's first just going to be the movements, and then I'll show you a couple loads that you can use to kind of really enhance that. And it's going to be great. Okay, so if you've seen anything we've done at the Gray Institute, one of the things you've seen is Gary Gray a long time ago. He came up with this idea of, yeah, okay, you can lunge one way, but you can also lunge a lot of different ways. And you could reach your arm one way, but you can also reach your arms a lot of different ways. And he kind of really started to put everything into a matrix. And so, you know, a lunge matrix was something that Gary thought of many years ago that people use. And in the golf swing, they're all really helpful, but these rotational lunges, these ones that really get the pelvis to rotate, really get the rotational motions in the hip to happen, are really key. And we're going to start with those, and we're going to start with what we call unilateral hand. That's just a single arm swing, okay? And so what you're going to do is you're going to take this right foot, you're going to do this right rotational lunge, and you're going to take from your golf posture, you're going to take your hand on up, and it's going to be this nice straight arm, single arm swing, like you're taking it right off it into your backswing. Go ahead and let the forearm have its natural rotation. Okay, let the palm of the hand rotate, and really try to get those hips to turn as much as you can. Get that belt buckle to point way behind you, and really you're just getting this nice opening up of your chest, this retraction of your shoulder, scapula. It's a great motion, okay? You can do the same thing, but now we're going to go around this way with our left foot doing a right rotational lunge. Still going to take our pelvis in the same direction, but it's now going to be working my right hip mobility a little bit more. When I opened up this way, I was kind of working on this left hip mobility and the external rotation of it. Now, as I close up this way, I'm working on this right hip and its internal rotation ability. And I'm going to do the same thing. really swinging that arm open, really trying to get those hips to turn as much as I can, okay? And that's really important because what that's doing is that's getting my pelvis to rotate, which as my pelvis rotates, that frees up all my spinal segments. And as my spine rotates, that really frees up my scapula. And then that scapula frees up that shoulder joint, okay, which is kind of really what we're after there. You can do that with the left arm too, but we're right now concerned about this arm. But it would be the same lunges, but you'd be working on with the left arm coming across, thinking more about this posterior shoulder and getting a good stretch through there. And then the same thing coming around there, okay?
Jonathan, just one tweak before we move on to what's really specific to the shallowing the club. If some of the people watching are a little bit older, sometimes the cervical spine will limit that motion. And so we would go through a sequence just tweaking it where they might initially look at their hand as they did that, and then they would gradually bring the head back down towards the ball, and that will loosen up the cervical spine so that it doesn't inhibit the big turn in the coil.
So that's great. I mean, when Dave's mentioning the cervical spine, that neck region, really your eyes, essentially. So he used his eyes, and he allowed them first to go with the hand, because our eyes we consider a powerful driver of movement. And that golf ball is really powerful. We know we need to hit that golf ball. So we aren't going to take our eyes off of that golf ball in the backswing. And so, you know, if we don't have what we need in our neck, that's going to eliminate that's going to, you know, make it a lot harder for the rest of the body to do what it's trying to do to make that big turn. So it's an awesome point. Love that, Dave. So this straight arm, we don't swing a golf club like that. Something golf coaches and golfers have been doing for a long time. You start to use this hook underneath your right elbow right here. So it kind of goes just above your right elbow, kind of on the back side of bottom side of your tricep right there. And you do those same lunges, but now you do it to that authentic platter position at the top of your swing. And I'm actually I really try to get my hips to rotate that big lunge, big shoulder turn, but I actually use this hand to kind of create a little resistance right there. So I don't just let it go where I freely want it to go. I kind of, as I'm warming up, as I kind of get that body feeling like it's turning nicely, I start to add just a little bit more resistance. So in a sense, I try to keep my elbow a little bit more in front of me as I'm doing it. So I'm really getting the turn and the depth from my body, and I'm kind of keeping that right elbow in front of me, okay? Do the same thing with that lunge that comes around this way. Get that arm again, hooked right up underneath there, that bottom side of the tricep. You're in your golf posture. Keep your eyes looking at the ball and really try to get a big turn and really just allow that hand to kind of create a little resistance right there, okay? Got one more for you. So the next thing that we're going to do is it's going to be what we call kind of it's almost like a pivot, okay? So it's going to be like I take my left foot around here, and then I kind of step over and open on up, okay? So what's going to happen is this is now the magic move. You keep going with that right arm like that, but as you go here, you step out. See here, and then as you lead with the foot, it drops that arm right in. So I close up, and then I step out. Close up, and I step out. And it gets that right elbow and that right shoulder to drop right on down. It's kind of a rotational lunge and then a step with the left foot to kind of initiate, and you have that right hand underneath, and that helps drop that down. So, you know, golf coaches have been doing that a long time, a drill where you here and you step forward right as you're coming on down. You know, so that's the initiation. So that's what I'm doing there is I'm just getting the hips to initiate the movement, getting the pelvis to shift, loading into that lead side, and it's getting that right shoulder and elbow to drop on down. So that's kind of a three-part sequence for you.
The real benefit of that, Jonathan, is without going into a whole specific thing, it gets that movement of the pelvis to facilitate and allow even more lateral flexion of the spine to allow that to come into that position.
Absolutely. I love it. I mean, I think that would be if I'm a golf instructor or if I'm a golfer and if I'm struggling with this over the top move, really a steep shaft, I'm working with someone, I think it feels so much like golf that they're right away getting that sense of ooh, okay. And if they pick up the club, I think they're going to really see that carryover, and they can do it right there on the range. You don't need to be in a studio. You don't have to lay down on the ground. You just get the club out of their hand for a second and have them go through a few of those movements, and you know, the body will take those resources and they'll be able to use it much more effectively with the drills and information you're giving them to try to help with shallowing the club. Okay, we got to go into some loading. All right, I always love loading movements. Who doesn't, right? It's fun. So first thing we're going to do is we're going to grab some dumbbells. Okay, so we're going back to those single arm, straight arm swings. Okay, so I'm going to take my right foot, I'm going to open on up, and I'm going to do that same motion that I was doing, but now I got that dumbbell. And as you can see, I'm allowing that dumbbell to rotate. So I'm not taking it back this way where it's turned down. I go ahead and let it rotate open. Nice. Okay. Close on up with that other lunge. You can see that gets you to get those hips to really rotate. Gets that thoracic spine to rotate, gets that shoulder blade, that scapula to retract. That's great. And again, do those same things with that arm coming across. And if you're training, that's really good training to work both sides there. So adding a little dumbbell is amazing. My favorite though right here is a sandbag, okay? The sandbag has this shifting sand in it, which does wonders for us when we go into that authentic platter position. So when I take this my right hand, and I can sandbag in my right hand, and I get that left arm again underneath on that bottom side of that tricep, and I go through these lunges, what happens is right as I get to the top of there, as I finish the movement, that sandbag dumps over, and it creates that awesome little mass of momentum of the sand falling, and it creates that little bit of extra load of external rotation there. So it's such good training when you're looking to expand someone's ability to externally rotate their shoulder. But again, I'm using everything to help. I'm not up here just throwing this thing back or with a band trying to get more. I'm using the whole body, and I'm now starting to really get that, okay? And then you can go again with that left foot rotating around.
Hey, Jonathan, one of the things that I love the sandbag too. If I don't have one, I can use, this is an unusual weight that has a hole in the middle that allows me to flip that. But if they only have a regular dumbbell, they want to get a light one, just hold it on one end instead of the middle and let the torque of the end just take that and take them into that platter position. Not quite as great as having the palm up, but it'll allow them to facilitate that with a regular dumbbell.
For sure. And if you have a really light kettlebell, you know, you can do the same thing where you don't swing it from the whole thing, but kind of start right here already. And so the kettlebell's already fallen over the top, and you can kind of just work from there. And that's going to help a little bit as well. But tell you what, if you can get your hands on a nice light sandbag, 4, 6, 8 pounds, it's such a good training for that. So you take that same sandbag and you go ahead and do where you lunge and then open up, lunge and then open up, lunge and then open up. And it's just creating all that falling of the weight helps to facilitate even more. So you're using a load to, in a sense, give you more range of motion, but control over that range of motion, because this is harder than what is even required in the golf swing. So that's why you train it. So you're creating more resources in your body that are actually even required in the golf swing. So swinging a golf club becomes, you're not even close to using all of your body's capacity to do it. All right, so one more, okay? One more.
Now, Jonathan, before we go to this one, based on what you just said, I want everyone to realize that the movements, if we're watching you, and I'm watching you, so they are too, they're so authentic to the golf swing. And the importance of that is not just how they look, but the neural perceptual information that's generated by that movement that's like the golf swing, that the body subconsciously learns to organize all of its resources. So it isn't a conscious thing you're trying to do. It's initially conscious as we go through the movement, but then eventually it becomes automatic because of that neural perceptual information. We can't emphasize that enough. It has to look like golf. It has to feel like golf if it's going to train for golf.
Awesome. Okay. So we're going to get even more golf specific. And I think we're going to use a drill that you are so accustomed to using as a golf coach and you've seen out there. and then we'll show you how to take a core ball and load it to get the even more benefit out of your body. It's the ranged basket drill. Okay, so it's the learning to dump the balls out of the basket at the right time. So, you know, I don't just dump it right away, right? The classic over the top move is rotate, club goes inside too early, and then it steepens coming out this way. Where if we keep the balls in the basket as we take the club back for a little ways, and then rotate and dump them at the top of the swing, and then drive the end of that basket down towards the golf ball, that's creating that right arm, that shoulder, all the motion that's needed to shallow the club, okay? And if you use a core ball, one that's got two handles on it like this, it could be a med ball, it doesn't have to be a core ball, but I love the one with two handles. You just take the same principles, and once the club gets about halfway back, you then start to add that forearm rotation, and you get that to then drive right on down, okay? So it's here, think you're dumping the balls over the top of your shoulder out of that basket, and then you're driving the end of it right on down towards the golf ball. Give you that face-on look for a couple. You can see it gets that right arm underneath that left, okay, right in there. You get that good forward shaft lean, club that's swinging on plane and not coming over the top. So this to me is just a great way, again, to add that feedback that you need into the body from a training standpoint.
Awesome job, Jonathan. Stuart, hopefully that was helpful to people, but are there questions that may have come up or something that you thought of that we should have covered more or better?
No, I think you guys delivered an absolutely fantastic presentation there. It was great to see Zach in there. And I think one of the big things, David, you just touched upon it for all the viewers, is how authentic the movements are. They're not in isolation. You're not in a static position. Everything's relevant to how you would be swinging the golf club, generating that flow, that feel, timing, tempo. And again, the feelings are so important for a golfer. So no, I thoroughly enjoyed it. And it's interesting, a lot of the times when you've presented for us, I tend to be with a couple of the others organizing the events, and we're always running around. That's actually the first time that I think myself and my colleagues have had a chance to sit and watch you guys go through this. So I thoroughly enjoyed it. There was a good question came in regarding senior golfers, David. You kind of touched upon it a little bit, but a gentleman that's been watching a lot of our sessions, David Hannam, he said he's enjoying the sessions a lot, as are a lot of other people with their comments. As a senior golfer, are there any adjustments or drills to focus on? I know you touched upon allowing the eye line and the head to move there a little bit. Is there anything else you would add for senior golfers to help them out?
Well, first I'd like to say, and I'll let Jonathan chime in at the end after I'm done, but David, thanks for the question. Any senior golfer can do the movements that Jonathan demonstrated. It's just that you have to, listen to your body, don't overdo it, don't be too aggressive. However, your point, Stuart, and his question is well taken. What can we do to better prepare ourselves for success in those movements? And sometimes for the senior golfer, the first biggest problem is a lack of mobility in order to be able to do that. And so one of the things we did for, in the content that we provided exclusively for the Golf Zone Live Better University was come up with three movement sequences for different parts of the A swing that David Ledbetter developed. And so as he went through and said, here's some training movements to facilitate your learning the A swing, Jonathan and I went in and said, well, here's some body training movements that will facilitate those movements. And one of them that we start on when we talk about initiating the transition is this part of being able to move the pelvis towards the target while the hands are still going back. So Jonathan, I'll demo this, but you add into it and give me some description. But one of the things we're going to do is when we look at support and we get in this is a true stretch, but it could be anything, a wall, a doorway, or whatever. If I can position myself so I get in that top of the backswing position, when we did the assessment for more of a buffer, can you take it further? That's an assessment. But one way to create more motion is to then three-dimensionalize this pelvis movement towards the target. So we know that we need some sagittal plane movement. So we're going to move the pelvis and go deeper into the backswing and then come forward. We're going to go away from the target, but then come forward towards the target in the frontal plane. And then all importantly, we can rotate a little bit more away from the target, but it's that rotation in this golf position towards the target in a very comfortable, stable position, feet in both hands on a supportive structure, using the pelvis as a driver that will really allow someone who's lost motion and mobility to initiate with some of that. And then maybe when they go through these movements, it's going to be a whole lot easier. Jonathan, what would you add to that?
Yeah, what David's talking about is, and then the question for David is that if you give the body support, so one of our training actions, we call it an action, just like a single arm swing is a training action. These lunges are training actions. A load is a training action. But if you give someone the training action of support, you're giving the body greater stability, which then it'll allow it to show its greatest mobility. And so that's just really important, especially when you're working with senior golfers. Balance becomes one of the things that starts to leave us as we get older. And so when you you could do the same movements we were doing, but hold on to something right in front of you there, a dowel rod or a nice stable structure, a golf cart if you had a golf cart, or anything that's going to give you stability. And you could have done those same movements, but now you're holding on to something and you're just giving them that support, go through the same lunges. And now that body is going to sense, okay, I'm secure, I'm stable, and I can start to now, I can go through those motions. And when you feel like you're going to lose your balance and possibly fall a little bit, oftentimes the mobility goes away.
Guys, fantastic. If we go then to the other end of the spectrum, we talked there about seniors. Everything that you've gone through today, how relevant is that to a young junior golfer, or are there any other areas that you would want to focus on in a developmental age?
Well, we know that the Ledbetter University has our friend Gavin there, who's working with the Ledbetter kids and with some of the other advanced master teachers that you have. And so they've got a great program. What we found is that maybe what we talked about today would be way too specific for a beginner or a junior, whether they were skilled or just beginning. One of the things that Jonathan and I found out when we did our functional golf system program live is we had movement specialists come in who didn't play golf but treated golfers, and they really didn't have any sense of how to swing. But after going through enough of the movements, by the time they were done of this 2-day seminar, they looked like they had been taking lessons all their life. But it's a matter of, for a junior program, we would select other movements that were more general movement that we call our 3D maps, foundational movements that are singular plane, but get this foundational movement skills for these individuals that Gavin and the rest of his colleagues work on. And then we would go to something that's golf specific for the backswing and for the finish. And then we even have those that are golf specific for impact. But you wouldn't give a beginner, junior, all those things. You'd have to choose the ones, as we know, that are fun, that are more dynamic, that are more moving, that allow them to say, hey, not only did I have fun doing this, but it's a little bit easier now when I put that club in my hand to be able to swing. And so that's really what the movement should do. They should prepare the body so that when you give a beginner, a junior, a club, it isn't a foreign thing, that their body's already been taken through a lot of the movements, whether it's through golf specific movements or the games that we want them to play, in order that they're then able to say, wow, I'm more focused on this club because I already know the movements. But Jonathan, you've worked with a couple of relatively elite juniors there. What are your thoughts on that?
Yeah, I actually had the privilege of working with one of the best 10-year-olds in the world recently. And I always start, like Dave said, first with more foundational type movements. So some of those that we were doing were lunges. Those were the rotational lunges. But you have a forward lunge, lateral lunge, crossover. But start to help them just establish more of in a sense, a more robust movement vocabulary. And so these foundational movements kind of just playing around with different jumping jacks, different lunges, shuffling in different directions, you know, things that are done, you know, on the athletic fields outside of just golf, really do prepare the body well to start swinging. And what's fun is in our functional golf system, we take those foundational movements and then do teach you how to make those more golf specific. So it's a really fun progression for juniors. I mean, if you're interested in the functional golf system, you learn these foundational movements, then how to make them golf specific. And like Dave said, you know, you develop the athlete, they make it a more robust vocabulary. And it's not, oh, they're the best athlete in the world, but they're just getting better at what their body can do. And in a sense, you help them develop that before you put a golf club in their hand. They might be served better than learning the skill first without developing some of that in their body ahead of time.
Yeah, perfect. I think we've got time probably for 2 more questions, and then there was a really short question I'll ask you before we get to close things out. Obviously at the start, Jonathan, you talked about the ability for the right arm to make the movement in the downswing to shallow. There was a question came in from Ellie Ankvetti, that is the difference between the elbow to the knuckle and the shoulder to the elbow, does that influence the capacity to shallow the club from the work you've done or the research that you've done?
There's a sense length of segments, possibly. Is that
yes.
what they?
Yeah. So wrist to elbow, elbow to shoulder.
I personally don't have any experience with that, so I'm not going to speak to it. What I would only say is that oftentimes the further, so this isn't someone's just anatomical structure, what they are born with, the length, but just if this is a smaller window, oftentimes that gets the arm more behind them. It gets stuck behind their body, harder to shallow it. Where if there's a little bit more width to that, so it's a slightly different looking angle versus in here, sometimes there's more freedom to get that right arm and to shallow the way you're looking for. But that I'm not going to speak to the other. I don't have experience with that. I don't know if Dave, if you do.
Not really any particular ratios. We do know that in baseball pitchers and maybe cricketers as well, bowling, but certainly in baseball pitchers with the arm, and that when they're playing young and they're doing a lot of that, their arm actually changes. The bone changes. It actually rotates in response to that stress. And so that's a good thing in terms of being able to do that. But that's just that individual. So what we're really saying is no matter what you come to the party with, if you don't have enough motion within the shoulder itself, but remember what we're saying is also how much that spine dictates what the scapula does. There's no quicker way to injure your shoulder than to shut down your thoracic spine and limit the scapular motion. And that's going to cause the true shoulder, the glenohumeral joint, and the tissues within it to get injured. And so when someone who is a golfer would come to us and they have a shoulder injury, whether they're a young junior or whether they're the senior golfer who's now developing this, we're going to look not only at how much external rotation they have, but even other parts of the swing. But it's really how the whole body contributes to that chain reaction. And more often than not, it's not going to be the shoulder's fault. It's going to be the spine's fault, because it's easier for that to just kind of hunker down and get really tied up. And so you're still going to be moving your arm during the swing, but now there's going to be more stress there because we haven't really maintained what we need in the spine.
Oh, brilliant. One quick question, really quick answer. The sandbags, there was a viewer asked who makes those and where can they get them?
Yep, this is a company out of Austin, Texas. Hyperwear is the name of the company, and these are called sandbells. So you could go to Perform Better. You could find that company. They'll source it for you, but then also Perform Better will also have sandbags as well. So Perform Better is a great place to go if you're looking to just find exercise equipment in general.
Brilliant. Last question before we close things out. We know that the average age of a golfer around the world is club member is around 50 plus, and probably doesn't practice a whole lot. Turns up to the golf club, has minimal time to get ready, get warmed up, go play. What would you recommend as kind of a go-to quick warm-up, emergency warm-up, if you like, to prepare themselves to play some good golf, but also reduce the risk of injury, obviously?
Oh, that's an easy one and a tough one, Stuart, because you do have to warm up. And as part of our assessment in the functional golf system, but also in the Ledbetter University course, we cover the 3 foundational movements that were described earlier, the backswing finish movements and the impact. Now, it's kind of like self-promotion, but we believe that's the best warm-up in the world that you can do. Because if you take the body through all those things and you don't force it and you allow it to show you success and the body remembers the movements and that perceptual information comes in, your body's going to know what it can do today, what it has today, but you really do need to warm up. But another part of your question, I don't want to go on too long, is what do you do when you don't have a lot of time to play golf? Well, you can do body movements to practice. And when I first met David Ledbetter, and he's very approachable, it's amazing. You would think someone that's a celebrity like him wouldn't care to talk to you. But one of the things when Jonathan and I got to describe to him what we were working on, he said, wow, that really could be an important thing, because in the wintertime where you live and where we live, but even when you don't have time to get to the range of the course, the body movements will facilitate that. Now, Jonathan has his own story about that kind of relates to his golf swing and his swing speed or whatever. So why don't you finish us up with that kind of anecdotal proof of what's going on here, Jonathan?
Brilliant. Yeah, well, they're just movement patterns, you know, is what David loved, and how, you know, you might get more out of doing some movement patterns even in the middle of your range session versus just hitting ball after ball after ball. And so, yeah, it was awesome when David really bought in and saw the value in it. But yeah, you know, as I haven't played as much golf as I did when I was playing professionally, I always had a club head speed around 110 and 111. Stopped getting to play quite as much, but actually got more into this training, started going through the Gray Institute's programs and started doing golf specific training like I'd never done before. I saw my swing speed go up without actually hitting more and more golf balls. So, you know, now it hovers in that 114 to 115 range at 35 years young. So I'm excited about that. So the authentic movements that are specific to the swing, it's amazing. The sequencing, the timing, the rhythm, things that you pointed to, Stuart, they really start to make their way into your swing. And all of us want to swing where we're not consciously thinking so much. So it's been really a passion of mine.
No, absolutely. And I think from a golf coach's point of view, whenever you can keep it simple for your students and you can not break things down and not take the flow, the timing, the tempo, that overall kind of speed out of the swing, because the danger we have as coaches is it's very easy to break things down, but then hard to build things back up for a player. And our job is always to be able to keep the player with some dynamics and some natural movement. And I think the beauty of what you've shown us today, it really highlights how you can work on these areas, but you can keep everything that you need to and develop it for the future. So, gents, what an absolutely fantastic session today. We can't thank you enough. I'm sure on behalf of all the viewers, we can't thank you enough, and thank you for taking the time to answer the questions. For everybody that's still viewing, in the chat box, there is a link. The guys at the Gray Institute here, as we've spoke about, developed a course specifically for the Golf Zone Ledbetter University, but they've also taken some segments out of that as a free taster course that is specially for you at the virtual summit. So there's a link there at learn.ledbetter.com for you to go and sign up for free and sample a few of the modules that they've put together. And then in the handout and the brochure, there's obviously more information about the full course and a discount code in there as well. Guys, it leaves me to close things out. Thank you once again for your time. We're eternally grateful for the relationship we have. And I'm sure all the viewers appreciate everything you've done for them today. And we look forward to connecting in the future.
Thank you, Stuart.
Thank you.
Thanks,
everyone.
Take care, everybody.
Jonathan.
Cheers.